Hi guys, it's Dale with the insurance. Today we're going to talk about an article that once again this is not political in nature. It's simply objective information, and we all have seen it and perhaps dealt with it, unfortunately, at one time or another. But the title of this article is 8 Reasons Healthcare in the U.S. is so expensive. Right? And we've seen the metrics. The metrics, to be honest, regarding our healthcare costs here are not pretty. The average person, I believe when this article was written, it was about the average person was spending about $8,000, right? The average American on healthcare costs. That's now closer to $11,000, right? But relative to the rest of the world, at least the developed world, people are spending half, right? So the U.S. tends to, especially when you see kind of a developed country, to see the healthcare system in shambles and cost so much, and so many people being without adequate healthcare. It's puzzling, right? And it's very expensive. These are kind of some things, some you may already know, but it's always good to kind of think about, why is this so expensive? Why are our healthcare costs are? The first item is drug costs, and once again, if you've had to fill a prescription, or God forbid you need a certain medication, more often than not, it can be quite expensive. And yes, our country has generic drugs, but the original had the patent. The patents last for 20 years, right? So the generic drug may not come out for a long time. So that price can be quite elevated, because they may have a pharmaceutical company may have the only product in the market. Also, our government doesn't actively negotiate. Our government doesn't negotiate drug prices, right? Except for, I want to say, Medicare. Is it Medicare? Kind of Veterans Administration and Medicaid. Actually, those are the two that the government actually negotiates with. All the other drugs, no negotiation at all in terms of the government. That allows, obviously, the pricing to just balloon. The second is administrative costs. In all of these, you'll find that all of these are kind of intertwined. The administrative costs come into play because the billing, the nursing, the entire system is so complex, right? There's so many different insurance companies, so many different ways and types to bill, that you need a ton of manpower just to administer healthcare, literally. And that adds to the bulkiness of the system, to the expensiveness of the system. The next is, I would say, it's almost a combination of cost of service and mix of services. But it has to do with the idea that in our country, in our system, we are specialist heavy. And you've been there. You've gone to your general practitioner, your general doctor. They send you to a specialist, right, to see something. That inherently is more expensive. In addition to that, Americans tend to elect procedures that are cutting edge, and because they're cutting edge, they need cutting edge maintenance, they need cutting edge technology. All of that adds to healthcare costs. The next is, and this dovetails to the complexity of the entire system, there's a lack of comparison shopping, right? Why would you, right? I mean, it's such a convoluted system, from billing to what services do you need? Do you need to see a general practitioner first? Do you need to see a specialist? There's just no comparison shopping virtually at all, because people elect not to do so. It's just such a cumbersome process. The next has to do with kind of our overall litigious society, right? So malpractice insurance is an absolute must for any person in the medical field. Unfortunately, these costs are oftentimes passed on to the ultimate customer, which in this case is the patient, right? Us, in terms of healthcare costs. The next one dovetails to drug costs, but it's not just drug pricing. It's the healthcare system in general. Our government does not play an active or a large primary role in dictating what is acceptable, what pricing, what level of coverage, things like this. And that's where, I hate to say this, but that's where the politics come into play. In other countries that have kind of half the cost on average, the average person spends half the cost on healthcare than we do. Their governments have a more active role in their healthcare system. And the last one just buttons everything up, and it's just the sheer uncertainty of the market, right? So obviously Obamacare came into play and changed the entire market, the entire ecosystem of healthcare. And ever since, things have, there's been rumblings and a desire to amend that, to change that. And each year, the market doesn't know when it's going to happen. And that's been going on for decades. I don't want to act like that's new, but just the uncertainty, the shiftiness of the foundation of the healthcare system causes providers, pharmaceutical companies, everybody to try to build that in their costs, right, to cover their bases. So those are, obviously there are other factors, but those are some of the few factors that contribute to us unfortunately paying such a high cost for healthcare, especially in comparison to those countries that are also developed and like us. Hopefully this was informative. Nothing you didn't already know, but once again, it's always good to kind of keep these things in the front of your mind. Thanks for stopping by, guys, and we'll chat next week.